My vulva was called a vagina, and I didn't hear the word vulva till I was 20. So we are spending a lot of our sessions educating. Sometimes the whole time.
We still always say vagina.
Yeah, we do.
Whenever we talk.
And I catch myself all the time.
I do it too. And it's because when we were growing up, we didn't learn this is your vulva, this is your vagina. It was just all this is your vagina.
Yeah. So
give your vulva some love.
Welcome to Pelvic POV with your hosts and doctors of physical therapy, Amanda Neary and Hannah Meyer. What up, pelvic freaks? Welcome back to another episode of Pelvic POV.
Where you're freaks for us and we're freaks for your pelvis, baby.
All right. So if you're listening to this episode, this is part 2 of our I Have Never Had an Orgasm series. And in this episode, if you didn't catch part 1, we went over the basics of the orgasm, what goes on psychologically, physically to make it happen, what it is, how the pelvic floor is involved, which is our specialty, and what can affect your orgasm that brings people into our office.
Yeah.
So in part 2, what are we going to dive into, Hannah?
We're going to talk about how we can help you with your orgasm.
Yay.
And the role PT plays with sexual dysfunction or difficulty with having an orgasm.
Yeah.
So excited.
Cool. Okay, let's start with what's up, Hannah? How's your day going?
I actually want to start off with saying that I got us a little gift. I'm actually mad. I'm going to be a little bit of a Karen to Etsy because it is not in yet.
Okay, is this what you were telling me about last week?
Yes.
I'm so excited. I'm dying to know.
I was supposed to bring it for this episode, and I was going to bring it so we could wear it together, but it's still not here.
What is it?
I got us a little, I got us matching red thongs, like G-strings that say pelvic freak on them with gold bedazzled lettering.
Oh my God.
Yes.
We should wear it for every episode.
I know.
And take a photo shoot.
I know. I'm sad. And potential merch, question mark?
Literally, yes. Also,
would you guys wear red thongs
that say pelvic freak?
Let us know.
Also, on that note, I learned this week that Chapel Roan says freak about as much as I do. Because I was watching a podcast that she was on, and she said, I was being a freak in Central Park, and, these freaks were following me, and I'm like, she's my freak sister.
Oh, my God.
And it made me so obsessed.
So are you saying that you are practically Chapel Roan?
I am here. She is me.
We are obsessed with Chapel Roan at our clinic, okay?
Yeah.
If you've never been to our clinic, we're going to throw microphones everywhere. If you've never been to our clinic, our music choice for our clinic is usually Chapel Roan radio.
Yeah.
If not, it's Sabrina Carpenter radio. Or if we're feeling moody, then lo-fi beats.
Lo-fi beats. Yeah, but mostly Chapel Roan radio.
Mostly Chapel Roan.
Obsessed.
When we're tired, we'll play lo-fi beats, and then when we've been yawning too much, we're like, okay, put on Hot to Go.
Mm-hmm. We bought tickets to see her at Lala together.
We're going to Lollapalooza. I got my Midwest Princess hat.
So good.
We're gonna throw ass at Lala Chapel Roan.
That was a necessary sidebar. I'm so excited for my thong. Thank you.
Exactly. I know. I'm so excited. Well, I'll bring it next time. I wish we could show our little pelvic freak. But anyways, I need to be a Karen about that and be like, where's my pelvic freak thong?
This is important.
This is major news. But we're excited to talk about this episode. We got our little sexy, dirty little chais. I got 2 espresso shots in mine, so mine's filthy. Amanda's is just slutty. I mean, dirty. Anyways.
Yeah, we're when we talk to each other, it's looking in a mirror. So sorry for how insufferable our sidebars can be at times. I love y'all.
We thought the dirty chais were fitting for us to dive into PT and sex.
So we talked a lot about what can go on regarding orgasms and the pelvic floor that brings people into our office in episode 1. But what are we actually doing about it? So do you want to start, Hannah, with how you approach treating sexual dysfunction in your patients?
Yeah. And I can start by talking about how we treat increased tension in the pelvic floor, because this is what we see a lot. So day 1, honestly, almost no matter what someone is coming in for, I am teaching diaphragmatic breathing. So diaphragmatic breathing, diaphragmatic sounds like a big word. So another term for this is belly breathing. So your diaphragm is a muscle under your rib cage. And I think of it as a cone under your rib cage. and it's right above your abdomen. And then below your abdomen is your pelvic floor muscles, and your pelvic floor muscles are almost like a bowl supporting your abdomen. So they're kind of encasing your abdomen in the middle. When we cue for diaphragmatic breathing, we're cueing to bring more awareness to the diaphragm to promote relaxation of the pelvic floor muscles. The way this occurs is because when we cue for belly breaths, like I'll say, imagine you have a deflated beach ball in your abdomen, and when you inhale, you're expanding that beach ball 360 degrees and smoothing all of the edges out. The same with the balloon. Sometimes I'll use a balloon as an example. But by cueing belly breathing, we're lowering the diaphragm down, increasing pressure in the abdomen, and therefore we're lengthening the pelvic floor in a more natural way rather than just like pushing to lengthen the pelvic floor. So the pelvic floor will gradually relax as the diaphragm pushes down. So they work together. Breath and the pelvic floor work well together. Big role in pelvic floor PT. Day one, we give this because it can be really hard and frustrating.
Absolutely.
To practice.
And the diaphragm isn't a muscle that you can like muscle into working. It's a responsive muscle. It responds to the way we breathe. So you have to be relaxed for it to actually activate that way. And I always say that you should breathe how like a baby breathes. Because if you look at a baby breathing, they naturally breathe diaphragmatically. I attribute this to like the stress we face as adults. And like we talked about like growing up in the 2000s, like suck it in, suck it in. Like you're not giving yourself that room to actually expand the abdomen the way that we want to allow the diaphragm to kick in. So I always tell postpartum people, like, watch your baby breathe. They actually are breathing the way the body wants to.
That's so cute. I'm going to start using that.
Baby breathing.
That is really cute. I also want to touch on the Tumblr era comment that you mentioned, because we joke about it and we're like, oh my God, the 2000s, 2010s, everyone was stick thin and it was a trend to be stick thin. And we have patients all the time when we cue for diaphragmatic breathing and we're like, breathe into your belly, let your belly expand, and accept that breath. And people have very emotional responses to that. I know I can relate to this a lot, but my whole life I was like, I got to suck in and be as skinny as possible so I can be the skinniest waist there is. People will come in and have very emotional experiences with that because they're like, oh my God, I've been breathing correctly my whole life. I've been doing this to myself just because I've been trying to suck my stomach in. And I'm like, no, do not feel ashamed of that, because I feel like so many people can relate to this experience. And that's what we're here for now, is to help you work on your breath and help with relaxing your pelvic floor. There's ways that we can work against these learned habits, but definitely an emotional experience that can occur. So if you can relate to that comment, let us know, because we can relate too.
We can relate to it. I did ballet growing up.
Oh my gosh, yes, girl. Yes.
Yes. Suck it in, suck it in.
Don't let it go. Let that belly hang.
Let it go. So our goal with breathing is really to get lengthening through the pelvic floor muscles. I think you have some good cues for like what you tell people.
I do. So when we're experiencing pelvic floor dysfunction, or if the pelvic floor muscles are too tight or have increased restrictions in the muscle, the pelvic floor will not want to lengthen in coordination with that diaphragmatic breath. So we'll be expanding or lowering the diaphragm to cue for lengthening, but then the pelvic floor bowl will just kind of stay there. And it's like, why isn't this working? So we can use some verbal cueing to help get that pelvic floor to actually relax. So one cue that I like to use, that I've been using recently, which is kind of cheesy, but then it's been working for people, so I just keep using it, is I say, imagine your vulva. When I'm working with people with vaginas, I'll say, imagine your vulva as a flower or a little rosebud. And when you inhale into your pelvic floor, your little rosebud is blooming.
Love that.
So your vulva is like blooming like a flower.
I love that. I'm going to use that.
Yes.
The blooming vulva.
Do you have any like cues like that?
I like
that you use. I use the beach ball cue too.
For breathing.
Yeah, like imagine you have a beach ball or a lip balloon in your belly, and then it's expanding lowering down, or 360 degrees.
I also learned in my vocal training, the inner tube analogy is good too. Like you have an inner tube around your waist and you're filling that up, and it's giving you that 360 breath, because we ignore like breathing into the back sometimes too.
Yes. We just will like focus on the
Yeah.
anterior
And I think when
portion.
you focus just anterior, sometimes that leads to people like pushing their belly out and you're not
Right.
actually expanding, you're just like forcing it. So I like the like fill everything because you literally have to take a deep breath to feel that.
That's a good cue.
So I use that sometimes. And then for like pelvic floor lengthening, I like having people picture like your pelvic floor is tight. So you're like holding onto a marble and you're keeping it stuck in there. And you want to try to not push out, but like just release enough where that marble drops. So it's like similar to your blooming one, but like you're just opening and lengthening.
I'm trying to do it right now. Wow.
I know you like have to breathe to do it. It's funny.
I like that one. I'm going
Yeah.
to start using that. I love learning how other therapists cue for
Mhm.
relaxing the pelvic floor.
Can all learn from each other.
I know. That's a good cue. I'm going to start. You can use my vulva flower if you want.
Oh, I absolutely will. I love the vulva flower. I want one. So
want one
cute.
too. We can have a little plot.
Little
We can have a little
plot.
plant.
Take a vulva flower on your way out. Welcome to the Pelvic Institute.
Vulva flowers for all.
Okay, so that's just like that's one thing we start with.
And that's scraping the surface.
just scraping the surface.
We
My
can
favorite thing to say.
I know. I love that.
Uh,
We can also manually stretch the pelvic floor.
yes, we use a lot of manual techniques. We talked a little bit about like trigger point release, but I think it's worth mentioning what that is. So we talked about like rewiring the neural pathways for the body to feel safe in response to a stimulus again. When we do a trigger point release, we're using usually one finger inserted either vaginally or rectally onto a pelvic floor muscle that has a trigger point response. So that may or may not be a tight muscle. Like if you have a painful response there, that's still a trigger point, even if there's no muscle tension there. Sometimes it could be a tension in a muscle that's causing that trigger point, but we don't fully know why trigger points are formed. So we're holding pressure on that point. I usually say like a minute to 90 seconds is when we'll get that central nervous system response to that stimulus. And you can actually, from our standpoint, you can kind of feel the muscle release into a little bit. And that's just the body saying, okay, this is safe. We can relax into that stimulus now. So that's one thing we do with manual therapy techniques. And then we have muscle release techniques where we have patients actively moving while we're doing internal treatment.
And then we coordinate breath work on top of all of that and put it all together. Depending on your specific needs and how your pelvic floor is functioning,
Yeah.
we will figure out what works for you when working with manual techniques.
Also with manual therapy, we can work on accessory muscles. So aside from just doing internal pelvic floor treatment, you have groups of muscles around the pelvic floor that can develop tension over time. And we have dry needling techniques, we have myofascial techniques that we use basically for the same response. Like anytime I'm doing manual therapy, I say it's neuromuscular re-education because you're really rewiring those neural pathways no matter what you're doing, but it's a similar concept.
Yeah. So we'll do manual therapy techniques, right, for the accessory muscles and the internal pelvic floor, but then we can use good old-fashioned flexibility training, mobility training, so those accessory muscles, the pelvic floor that Amanda was talking about. So think about your glutes or hip flexors or your adductors, which are your inner thigh muscles. These are accessory muscles of the pelvic floor. Since they're in such close proximity to each other, to the pelvic floor, the accessory muscles and the pelvic floor in such close proximity to each other, they influence each other greatly. So by working on flexibility and down training of those accessory muscles, it can then help to relax the pelvic floor. It's like almost like feed forward relaxation. So that's why sometimes we'll work like hamstring stretches, happy baby, child's pose, and stuff like that.
And then in addition to exercises, we have tools that we prescribe for patients to use at home to help supplement our care. So there's different release tools and stretching tools. So one that we prescribe is a pelvic wand, which is a way for patients to do their myofascial trigger point releases on their own. This wand is inserted vaginally or rectally, and it's angled at a trigger point, and you would basically hold pressure on it the same way we would manually. And it helps patients become more self-sufficient with exercises, supplement our care, and then long-term, if they have something flare up, it's like, okay, I can kind of handle this on my own. Don't need to go back to pelvic floor therapy because I already did my course of treatment, and now it's just a tune-up that I need.
Exactly. The two main ones that we will prescribe in the clinic are dilators and pelvic wands. Dilators can look pretty scary. They kind of look like a bunch of dildos lined up next to each other in different sizes, but a little less fun, just like the stretching portion. And they come in a bunch of different colors: green, blue, pink.
Fun
No, wait,
colors.
pink isn't one, but they should make pink dilators.
No, there's a pink one.
There's a pink one?
Yeah.
Okay.
I think so.
I hope.
Now I have no idea.
I don't think there is. There should be. Make us pink dilators. I want dilator set, all different shades of pink. Anyways, dilators are used more for example, if you have that like ring of fire like energy in your pelvic floor. Like it's very tight pelvic floor and it hurts to even, or it's hard to even insert a tampon or a finger, or it hurts to insert a penis, or you can't insert a penis all the way, or a dildo, or whatever it is you're using for penetration. There's two main roles for the dilators. One is to physically stretch the muscle, and then two is to help build safe memories. And we touched a little bit on this in episode 1, because if you have experience with pain with penetration, then we start with a smaller size dilator and help build safe experiences with penetration. So it's like, oh, maybe this isn't as painful, and the body becomes more accepting of that penetration. So that's where dilators can come in handy.
Another tool that I've recently started using, it's new. I think the company calls it a Kiwi, but it's basically like a combination of a smaller dilator. So it works on like insertional pain and it allows for that shallow penetration. But then there's also like a vibrating component that goes over the clitoris or wherever your pleasure centers are. So you can combine that insertional treatment with those feelings of pleasure to start rewire those pathways and say, not only is this safe, it's actually fun and it feels good. And I love that. So I've started showing more patients that. I have one at home, love it. So all of this in combination. So basically what I would call this treatment is the pre-sex routine. So when patients have sexual dysfunction, I'll give them a breathing exercise, a stretch, a mobility exercise, maybe a tool to use at home themselves before they have sex. This goes along with like behavioral changes of maybe scheduling sex for the time being so that they can anticipate that stimulus. And if sex is more spontaneous, saying like, okay, let's take a beat. I have to do my like 5 to 10 minute sex routine and then see how it responds, or just comparing different times to others. But yeah, treatment is basically the pre-sex routine for pelvic floor therapy.
Yes. I love the pre-sex routine. I use that as well. I'll give like maybe some cat cows, a couple stretches to help warm up the pelvic floor almost.
So warm up.
Yes, it's literally like a warm up for sex. Sex is an exercise. Sexercise.
Yeah, and I mean that's just, I'm not going to say it. That's just getting into what we do.
Say it. I know your body wants to say it.
Just
scraping the surface
of what we do for sexual dysfunction in pelvic floor therapy. So that's to give you a little taster. If anything we said in that section of this episode resonated with you, definitely send us an email, shoot us a comment. Our email is hi@pelvicpov.com, by the way. If there's anything you want us to dive deeper into, let us know, because we are episode planning and we're happy to dive deeper into it.
And we can always put questions into our Q&A episodes, or at the end of episodes is what we're thinking of doing in future episodes. So, but another thing I wanted to say before we move off this topic is don't just go willy-nilly and buy your own set of dilators or pelvic ones on Amazon or anything like that. We definitely recommend seeing a pelvic floor PT first, because there are definitely different things that we look for when looking at your pelvic floor to determine if we want you to use a dilator or if we want you to use a pelvic wand. So definitely see your physical therapist first before going out and searching for those tools on your own.
When in doubt, get assessed. That is
when in doubt, get assessed.
Say. It could be a cuter catchphrase, but
when in doubt, see your PT. When in
doubt, test it out.
When you got a pee, see your PT. I don't know.
That's cute.
So let's talk a little bit about some tools to increase pleasure, because we talked about some tools and techniques that we use to help like stretch the pelvic floor if you have some type of dysfunction, which we treat commonly. But specifically when talking about increasing pleasure for orgasm, which is the topic of this episode. Come on, say it. What do we want to talk about?
We want to talk about lubricant, don't we?
Lubricant.
Oh, we love lubricant.
We love lubricant. I always say, even if you can get wet on your own, we want you to use lube.
Yeah. You want you to use lube. You just don't know it yet.
Exactly. I always think about that episode of New Girl. Did you watch New Girl?
Oh my God, yes.
So do you know what I'm talking about already?
Schmidt?
Yes. The episode of Big Schmidt when he's in college, when they do that flashback and he has sex for the first time. I think it's the episode when they talk about losing their virginity, and he has sex with Elizabeth for the first time, and Schmidt has this huge tub of lubricant and they like dump it all over themselves and they're like slipping everywhere and they're on the bunk bed. And then Nick is underneath them like, what is going on?
It's so good.
That's what we want you guys doing. We want you guys just covered, drenching yourselves in lube.
Actually, just dump it over your head. Use the lubricant that way.
We need to post that picture of
It's so
Schmidt
funny.
in college
We have
using the
to.
lubricant on our social
Absolutely.
media. That's funny.
No, but in seriousness, lubricant can really enhance your sexual experience and it can increase orgasms. I don't have the actual stat on it at the top of my head, but it does increase pleasure.
Yeah.
So that's really cool.
And let's talk a little bit about the different types of lubricant. So we'll briefly scrape the surface. We're going to stop now. We'll briefly talk about different types of lubricants. So there's water-based lubricant is one that we use in the clinic. This lubricant actually is really good if you commonly experience yeast infections or urinary tract infections or things like that with intercourse, because it's good for sensitive skin. It also absorbs into the vagina since it's water-based, so you might have to reapply it more often throughout sex. There's also silicone-based. Do you want to talk about silicone-based? I know we love lube.
Yeah, silicone-based is going to not absorb into the skin, so it's going to stay lubricated kind of the whole time. So
It's slippery.
I like silicone-based lubricant. I use water-based for all my exams because it's the least offensive to all bodies. But if you're playing with lubricant, you're finding which one you like the most at home. I love a silicone-based lubricant. It stays moist the whole time, and you don't really have to reapply it. It's fun. You just can't use it with other silicone toys because it will break down the silicone in the toy.
Yep. We don't want you to use the silicone-based lubricant on dilators or pelvic wands or dildos or vibrators or anything like that.
Yeah.
Those toys are expensive, okay? Don't break them down.
Protect those. But yeah, long story short, lubricant is good. Is great.
It's fantastic. They also
fun.
Another lubricant I've been talking about recently is Good Clean Love. This one's good to use for dilators. I've been recommending it to patients lately if it hurts to pull the dilator out, if it's been sitting for a while, because that water-based lubricant will absorb into the skin. So I've been recommending Good Clean Love. I don't know the exact ingredients in that. I got to look into that. And then another one, which we want to get samples for our clinic to see what this is like, is that CBD-based lubricant. I don't know.
Yeah, be interesting.
Yeah, I want to see.
Got to learn more about that.
Yeah, we'll have to learn more about. So don't quote us on that yet. We'll see. We'll do our own research first before we recommend it to people. But
yeah,
that's something that could be interesting.
But yeah, lubricant is a big part of what we talk about with patients. Oh, and the other thing I didn't touch on is patient education, which is arguably the most important thing.
We're educating right now.
But when patients come in for sexual dysfunction, there are so many topics that maybe they haven't had addressed in their lives, or things that they've had fed to them through the media, or just like however their upbringing was. And we're relearning a lot of concepts. We're teaching concepts for the first time. We're helping people get to know their bodies in ways that they maybe didn't learn in school. Because as women, we know we didn't learn about our bodies in school. My vulva was called a vagina, and I didn't hear the word vulva till I was 20. So we are spending a lot of our sessions educating, sometimes the whole time.
We still always say vagina.
Yeah, we do.
Whenever we talk.
And I catch myself all the time.
I do it too. And it's because when we were growing up, we didn't learn this is your vulva, this is your vagina. It was just all this is your vagina.
Yeah. So
give your vulva some love. One thing that we touched on in the first episode is sometimes having a tense pelvic floor can lead to having a weak pelvic floor. So alongside exercises like breathing and stretching and down training, we also will do like strengthening exercises for the pelvic floor. An orgasm is a maximum pelvic floor contraction. Your pelvic floor can co-contract with your transverse abdominis. So doing a lot of core strengthening, deep core strengthening, learning how to engage your transverse abdominis properly, especially in coordination with your pelvic floor with exercises, can greatly enhance your orgasm, which is something that we do in the clinic as well.
Yeah. And on that note, when we say pelvic floor strengthening, we're not necessarily talking about Kegels.
No.
There are plenty of ways to strengthen the pelvic floor that are not involving Kegels, especially if you're coming from a stance where you have a tight pelvic floor. We don't want to be doing Kegels and making that tension worse, and you're not also getting a full contraction that way. So many other exercises we can do.
Do not be sitting at home doing Kegels.
We don't want you doing that.
When you scroll past that TikTok video and she's like, Kegel check, and she's like, let's try Kegels, and then you try to Kegel, and she's like, Kegel every time I clap, scroll past.
Keep scrolling. Don't even give them the engagement.
You don't need it. Don't need it.
Yeah. All right. So let's dive into some myths about orgasms.
Ooh. I can read myth 1.
Yeah, read it.
Myth number 1. about orgasms. Women can only orgasm through penetrative sex.
False.
Big false.
We touched on this in the first episode, and
What was the statistic?
96%, I believe.
The 96%.
Somewhere in the 90s of people with vaginas need clitoral stimulation to orgasm.
Yes, and that statistic is not from Love Island, USA.
No, it is not.
That statistic is from somewhere where statistics are facts.
Scientific.
I don't know
fact.
where you got the statistic.
We'll get to it, actually. So, yeah. Myth number 2. People with vaginas have to just fake it till they make it. False.
False. And this statistic from Love Island, 67% of women or people with vaginas fake their orgasms
Yeah.
from the people surveyed. Boo.
Boo, we don't want that. And it's not fun for anyone involved.
Myth number 3. Women who don't have orgasms are broken.
Yeah, that one makes me sad because it's something we hear from people a lot when they walk into our office and they're like, okay, I haven't had an orgasm. Something's wrong with me.
That makes me really emotional because a lot of people really do think that.
Mm-hmm.
But no, it's so common to not ever have had an orgasm.
Mm-hmm.
It is so, so common. And that's why we want to talk about this. And specifically, the title of this episode is I've Never Had an Orgasm.
Yeah.
You are not broken.
You're not broken.
There's so many people that have never had an orgasm before or struggle to have orgasms.
Yeah. And it might be a combination of therapies that's needed, but it could be a simple fix. It could be something that just needs to be worked at. It could be something where you just need to learn what your body prefers because everyone's body's different.
And that's
Everyone.
going back, sorry to cut you off.
Yeah.
But that's going back to the first episode where we talked about the stages of having an orgasm and we talked about the senses and using all of those techniques and exploring your body and exploring what your body accepts as a stimulus for an orgasm. All right. Myth number 4. Men never have difficulty achieving orgasm. F-A-S. Guys, thank you for being patient with us. I'm not going to apologize. I'm going to say thank you for being patient with us. This is our 3rd time recording this portion of the podcast episode because our camera died and then our mixer died and then it didn't record one time. So
We're loopy.
we're losing it. That's the only reason I just misspelled that.
Yeah.
The only reason.
The only reason. False.
False. F-A-L-S-E.
Nice spelling, Hannah.
Thank you.
Good job. Yeah, this is false. We see people with penises in the clinic for difficulty achieving orgasm, having an erection in general, often due to some degree of pelvic floor tension. Pain with orgasm, they have similar symptoms to women. Might not be as frequent, but it definitely happens.
And that's going back to the first episode when we talked about ischiocavernosis and bulbospongiosis. We talked about it a lot with the female anatomy, but specifically for people with penises, that those muscles play a big role in getting an erection and maintaining an erection. So those are muscles we can work on if you have tension in your pelvic floor or a weak pelvic floor to improve your erection quality and orgasms.
Cool.
Yeah.
Mm-hmm.
Which is awesome.
Yeah. All right, and we have a couple questions from listeners, which we're so excited about. Thank you guys for submitting questions.
Yes, thank you guys. We love seeing questions in our inbox because it helps us figure out what you guys want to hear from us.
Yes. So, question 1.
Question 1.
You want to read it?
Yeah. How can strengthening your pelvic floor help sex be better? Because slay.
Because slay. No question mark. Just because slay. I love it.
Do you want to dive into that a little bit?
Yeah. And we talked about it a little bit. Part of the orgasm is the involvement of the full pelvic floor contraction. So it makes sense that a stronger pelvic floor will contract more fully and you have a stronger orgasm. And we can also think about it going back to that sex response cycle from the arousal stage. Part of that arousal stage is increasing blood flow to the genitals. And when you think about a strong muscle having more muscle tissue, you are going to have more blood flow in that area, more blood pumping to that area. So if you have more muscle mass in the pelvic floor, more blood flow, stronger contraction. Oh, I love it. It's so cool.
We didn't talk about that before. I'm glad you brought that up.
Yeah.
Heck yeah. That's why these questions are important.
Yes, we love your question.
And then on top of that, this question says, how can I strengthen my pelvic floor at home to make orgasms better? And I think with this question, I want to emphasize don't just focus on the strengthening component, because we talked a lot about how important it is to relax the pelvic floor in order to get that strong, full contraction. Like when we talked about that bicep example, right?
Yeah.
So working on your breathing at home, relaxing your pelvic floor, whether it's like with meditation, yoga, for example, things like that. And stretches, flexibility training can help you potentially to start strengthening your pelvic floor. I want to give some exercise examples for things you could do at home if you did not assess this patient and it's someone that doesn't have pelvic floor dysfunction, I guess, for example.
Yeah. So first of all, don't do Kegels, because I know what you're thinking. You might be doing them right now. Don't do them. We don't want you doing Kegels.
When you pass that TikTok and she goes, Kegel check, and she has you do Kegels every time she claps, just keep scrolling.
Keep scrolling. Don't give them the engagement. There are so many ways to strengthen the pelvic floor muscles that don't involve doing a Kegel, which can make dysfunction worse. So please don't do that. Some basics I like to tell people about are glute bridges, clamshells, some deep core stabilization. So like tabletop position, knee hovering, bear hold, that kind of stuff, planks, body weight squats, weighted squats. All of these exercises are going to make the pelvic floor kick in, and it's actually a good way to strengthen those. And then I love Pilates. When people say they do Pilates, I'm like, hell yeah, because I love Pilates and it's really good for your pelvic floor.
Yeah, if you go to like Pilates classes, yoga classes, bar classes, anything like that, general exercise is going to be healthy for your pelvic floor, just like it's healthy for any of your muscles, especially if you don't have pelvic floor dysfunction.
Yeah.
Just staying active and making sure you're strengthening your muscles. Any deep core activation is going to be great. Like we talked about earlier, your transverse abdominis, that deep core muscle, works on co-contracting with your pelvic floor to make that pelvic floor contraction even stronger. So doing any kind of deep core work is really going to help.
Yeah. Cool. And then another question we have is, what are some tips for communicating to your partner that sex is painful without making them feel bad?
Oh, this is a good question.
You want to take it away?
Do you want me to start?
Yeah.
Okay. I can actually talk about a little tip I heard from another podcast I listened to. I listened to the Sex with Emily podcast, and she is a sex therapist. If you haven't listened to her podcast yet, you should definitely listen to her podcast. I love her content. One key takeaway I have learned from her is any conversations you want to have about the bedroom, whether it's pain with sex, or even we could talk about this question in terms of some tips for communicating difficulty with the orgasm too. Always make sure to have those conversations outside of the bedroom. Because if you are having those conversations, say right before sex or right after sex or in the bedroom where you most commonly have sex, it's going to put a lot of stress on that situation. So let's kind of take that conversation out of any of the stages of arousal or desire,
and that makes sense, because then your like overthinking centers of the brain are working overtime if you're having that conversation before sex, and that's what we want to turn off to have an orgasm.
Exactly.
I love that.
That's one of my favorite takeaways I've learned from her, and I've used that myself, and it's really helped. So I think that's great.
And I think everyone's communication with their partner is different. So just to add to that, when you are trying to have these conversations, this isn't something that we don't hear. Like I have a lot of patients ask me how to communicate with their partner without making them feel like they're the problem. And it's just, people like knowing what's going on. So depending on how comfortable you are sharing, like if you have specifics for, what muscles are involved and where this may have come from, like describe the sex response cycle to them and say like, listen, the desire's there, the libido's there. That's not like a you issue. It's not an us issue. Could be something you work on together, and they might want to be involved in that. So just finding your little segue into that conversation with them and what you think is they're going to like be the most responsive to and understanding of. And if you are seeing us for pelvic floor therapy or a pelvic floor therapist, you can bring them with you to your session.
Exactly. You ate with that, by the way.
Oh, thanks.
You did really good. I have people bring their partners in all the time. Actually, this just happened too. But I always tell people, I'm like, for example, if I'm working on perineal massage with someone and I want this person doing it at home, then I'm like, bring your partner in and I can teach your partner how to do this for you so you guys can do it together. And you could even use it as a warm-up for sex. You can use it as one of your pre-sex...
Your pre-sex routine?
Yeah, your pre-sex routine. We have people bring in their partners all the time. Don't feel nervous about that.
Yeah.
That's
I love
a great
that.
way to help with the communication portion.
All right,
Good
Hannah.
questions. Thank you, listeners.
Thank you, listeners.
Send in more questions.
Yeah, send us more questions. Okay, so Hannah, what's your takeaway from everything we talked about in this series? What's your expert takeaway?
My summary, my
Your
conclusion. Not feeling ashamed with self-exploration. I feel like as a woman growing up, we talked about this a little bit earlier when talking about health class and how we were just taught this is your vagina and we weren't even taught about having vulvas. You know, the same thing with like masturbation, for example. I feel like even in high school, men would masturbate and it was normal to even talk about that and it was common and they definitely didn't feel ashamed. But if I masturbated, I felt like it was like, I should not talk about this. Like, oh my God, this is bad. I need to keep this quiet. Is this weird? Because no one talked about it. But we deserve pleasure just as much.
Yeah.
You know what I mean? And not talking about it just adds on to the shame that we experience and contribute to issues with having an orgasm later on in life. So we shouldn't be ashamed about masturbation, feeling pleasure, or self-exploration, because those are ways to help improve your orgasm, right? So yeah, that's my biggest takeaway. Just don't feel ashamed, and it sucks that we grew up that way, but times are changing, baby.
Times are changing. I love that.
What's your biggest takeaway, you would say, that you want the public, our pelvic freaks here, to take away?
Okay, pelvic freaks. Honestly, if you've made it this far in the series, you're already doing my biggest takeaway, which is to learn more for yourself. And even if you don't like physically explore that, for me, what made the topic of orgasm so fun and so accessible for me was just like diving deep into my anatomy. And I feel like you talked about this a little bit, but like, I think it's so cool that all these muscles work together to have this like really big euphoric thing happen for us that we get to experience. And knowing more about like what the bodily response is and what turns people on, it just made it so fun, so juicy for me. So I think if you're here, you're probably like-minded and that you want to know more. And there are so many resources. So explore your resources is my biggest takeaway. Consult your pelvic floor therapist. Ask a sex therapist. We love therapy at this office. We refer to it all the time. And another
therapy clinic right above our clinic.
We do. They're great. And we often co-treat sexual dysfunction with therapists because it's super important to get that component. And then another resource that I love that we send patients to is omgyes.com. I have recently worked through this material myself, and let me tell you, it will elevate your experience. It is so good.
I love omgyes.com. Go check it out if you haven't heard about it. This website is amazing. It's actually evidence-based, research-based ways for improving the female orgasm. And it gives you self-exploration techniques. But it's an evidence-based way. So for like all my freaking pelvic nerds out there,
so good.
This is evidence-based research for you to have more pleasure. And that's amazing. And it's from physicians too.
Yeah. Love it.
This website's super cool. It has animations and it explains different techniques, and it has real women with real vulvas showing their techniques for masturbation or ways to reach an orgasm. So you can use those techniques at home and you can practice and you can show your partner as well. They teach you about how to use toys with masturbation and things like that too, which is really great.
Yeah. OMG, yes. Love it. All right. Well, that concludes our 2-part series on I've Never Had an Orgasm, and we hope that we shared something valuable with you in this episode. So please make sure to subscribe on whatever platform you're listening on and leave us a rating if you enjoyed this episode. Make sure you reach out with any questions or comments, things that you want us to talk about in future episodes.
Or if you are a pelvic floor PT and there's any resources that you use for patients that we didn't mention in this episode, then send them in. DM us. We check our DMs and we check our inbox almost daily.
Yeah. Make sure you're following us on social media at Pelvic POV.
And follow our personal accounts at Hannah Meyerr, Meyerr.
And Amanda Neary, PT, N as in November.
N as in no thoughts, just orgasms, baby. Thank you, guys.
All right. Peace out, pelvic freaks.
Peace out.